Welcome back to Business Matters. And now I have the great pleasure of welcoming to Business Matters Dr. Nicholas Papapetros and Dr. Leo Karen, both dentists from the Cornerstone Dental Group in Westford. And Dr. Papapetros is the founder of Cornerstone Dental Group. So welcome.
Thank you.
Pleasure
to be here.
Great. And this is very fortuitous because February is Dental Health Month, isn't it?
Yes, it is.
Yeah. And what made you start to explore the world of dentistry, Nick?
Well, medicine was always an interest to me, and but dentistry allowed me to sort of blend science with art. We do a lot of cosmetic dentistry and help rebuild smiles and things like that. So it really helps sort of blend those two disciplines, and it's just people. You get to see people. I know right now I've been in practice for over 25 years, and I'm seeing third generation of patients,
wow.
and it's just exciting. So it's been a great profession.
Excellent. And what's your favorite part about the business?
Well, the people, developing relationships, and even team members. Though I tell you, we've got some great people that work with us, and some people say, you spend more time with people at work than you do with your family at home, and just our staff is so warm and caring, and fun to be with, and it's a great, again, a great part of the business.
And I understand Cornerstone Dental Group is your fourth office. That's fantastic.
Yes, thank you.
Where are your other offices located, and how did you choose the Westford community?
Well, right now I'm in Andover, Massachusetts, Salem, New Hampshire, and Bedford, Massachusetts. And honestly, Westford, we love the town. It's a great community. And then also with Cornerstone Square, the whole development, it's so vibrant. There are a lot of people around there, and we were very lucky that they developed a medical building that allowed us to basically build a practice from scratch. It's very high tech, very modern, and we've been able to build in technology that sometimes you can't do, in an existing office. So being able to build it from scratch, it was a great,
what a wonderful opportunity.
Yeah.
And Dr. Karen, what makes the Cornerstone Dental Group different from other practices and offices?
Well, for any enterprise to be successful, you have to have a harmony of a few elements: team, technology, and the knowledge. So the team, we just have terrific people, very dedicated. Everybody's cross-trained, so everybody knows the flow. From the moment you call the office to the moment you walk out, you feel like you're in a very warm and caring environment. And that's what the team is really on a mission. The mission is simple: provide the best care, the care that our patients deserve, in a safe, warm, and friendly environment. So the second part of those elements is technology, and we'll talk more about that later.
Great.
But we really, I think, did a terrific job with that. And the last part will be knowledge, or education, so to speak. Dr. Nick, myself, we really dedicated ourselves to excellence in dentistry. We love it. We love what we do. It's a really fun times to be practicing dentistry, and there are so many things we can explore and learn, and we do on a daily basis. On a monthly basis, we fly to conferences, we stay involved. Both of us are members of Academy of General Dentistry. We love what we do, and it's just a passionate thing.
And it shows, yes. And I really think the idea of the cross-training is so smart for your business. That's an excellent idea that you've incorporated. Dr. Nick, what can patients expect on their first visit to Cornerstone Dental Group?
Well, first we have an office tour, so that we can show off our state-of-the-art facility. We go through our advanced sterilizing area. Patient safety is utmost with us. It's unlike most you'll see in any other dental office. Our operatories, then we'll go into you'll meet the staff again, our team members. Again, just so you know who you speak to, who answers the phone. You'll have a patient coordinator. Somebody will take you into the operatory where we'll do our dentistry. Once we're in the operatory, we'll take all the necessary x-rays. We'll examine your gums for any signs of gum disease. We'll look at teeth for cavities. We'll go over medical history, medications, how these things can affect your oral health. And so once we do all that, we're, basically as a partnership with the patient, we'll come up with a plan that's for that patient. And typically, it takes about an hour. And, at the end of that hour, you'll have a pretty good idea of what's going on and what we can do for you.
Excellent. So the individual treatment plan is developed.
Absolutely.
Excellent. Great. Dr. Karen, tell us about the technology that's used in your office.
That's a fascinating subject on a daily basis, actually. So there is a lot to cover. One of my favorite toys will be the FDA-approved laser cavity finder. So instead of poking a teeth with sharp instruments, we use a diagnostic laser beam. It tells us where the cavity is, how deep it is, whether or not we need to treat it, monitor it, or if we do need to treat it, what the approach will be. So that's brilliant device. We also have, we call it the magic wand. This is our basically, we call it single tooth anesthesia. So when you come in, the needle is tiny. People usually don't really feel anything at all. We numb up just that tooth and nothing else, so you don't have to spend your afternoon drooling all over the place. And a lot of times when we're done, patients ask us, when are you going to stick us with a needle? We say, well, it's done already. You're already numb. So people get fascinated by that. We have a 3D capability. We have a dental CT scan, which is state-of-the-art technology. So traditionally, dentistry is two-dimensional. You're looking at the X-ray film. Everything is two-dimensional. Here we have fairly low radiation on that CT scan, but it gives us an amazing amount of information. We can look at structures in 3 dimensions. We can plan for implants. We can look for tumors. We can look for development of with children. We can look at their development and how they're growing. It's a really fascinating device. We use digital impressions. So if anybody who ever had any dental work done, you probably remember sitting with the goopy stuff in your mouth and counting the minutes and seconds and when is it going to be over. No need for that anymore. We'll basically scan the arch, we'll scan the teeth. It's all digital. Creates a model. We send it to the lab with a secure connection, and the lab actually gets to work on the case before the patient even leaves the building.
Wow.
So that's, we have lasers. We do quite a bit of surgery with lasers. Instead of traditional scalpels or blades, you just basically very cleanly, neatly, you do that. Very little anesthesia required and virtually no post-operative sensitivity or pain. Heals up beautifully. And the whole office is all digital. Basically, no more paperwork, no more hassles with that. We use digital radiation or digital sensors, basically, so the radiation is down by about 90%. Big concern for a lot of people lately, so we kind of in the forefront of that.
Very good, very good. Fascinating. The efficiency that technology has offered the dental industry.
It changed the world.
It's just amazing,
Yeah,
amazing,
absolutely.
yeah. And Dr. Nick, tell us about specials that you offer your new patients.
Well, as part of Dental Health Month, as well as part of the Middlesex, this TV show, we'd like to offer any new patients that come in for a comprehensive exam, if they mention the show, we'd be happy to give them a free Sonicare toothbrush.
Wow.
And also we're offering a free second opinion. So if you have a question about what's going on in your mouth, or if you're having something done and you want to have a second opinion, well, we'd like to offer a free second opinion to anybody out there.
Great. Can you tell us more, Dr. Karen, in detail about the services that you offer in your practice?
It's a full range dental practice. So from professional cleanings to gum therapy, we actually pretty big on prevention. With kids and adults alike, sealants, fluoride, our diagnostic equipment lets us detect early signs of cavities or gum disease, so we can treat that in the office. And then we kind of build upon that. Obviously, traditional white fillings. We do porcelain crowns. We basically don't use any metal in the practice any longer. So it's all tooth colored, very aesthetic. Crowns, bridges. We do root canals, removable appliances such as dentures and partials, and then we'll place implants with the aid of 3D technology. And then we can go into something more complex. We do complex restorations. We can do full mouth rehabilitations. Somebody who needs a cosmetic, a brand new smile, basically, as part of their new look or what have you, we're ready to provide that. We'll give people basically complete and revamp bites, and so they can actually function and enjoy their life.
Wow, very comprehensive services.
Yep.
Excellent, excellent. Dr. Nick, for someone who's not that knowledgeable about dentistry, can you give us some ideas to how often a patient should come in to see the dentist and also to see the hygienist?
Well, typically the standard is every 6 months, and but that's basically we try and do it for every individual. So there are certain conditions that might require you more often to come in to see us. Diabetics, sometimes pregnancy, people with heart conditions, elevated A1Cs. These people we might see every 4 months, every 3 months. So we try and tailor it to what the patient's needs are. You know, I don't want to just say every 6 months, but I mean traditionally it's every 6 months, and that's for professional cleaning, an exam by a doctor. And you know, again, as Leo was saying, that we really try and prevent things. It's much easier to catch things when they're small, when it's early, and so you know, we try and tailor it basically on the patient's needs.
That's great. That's great. And I understand you've been practicing since 1992. And tell me, from your perspective, how the dentistry world has changed, and what are some of the advances that you are so excited about?
Well, it's interesting. I really don't do anything the same that I did when I first started. I mean, we still, yes, we remove cavities, we put fillings in, but the materials have changed. How we use these materials has changed. How, you know, everything in the office now is either sterilized or disposable. We provide, you know, with technology, digital radiography, 90% less radiation than we used to do. It's just really everything we do is different, and it's really, even the anesthetics are different. It works faster, it's more profound. So really everything's changed in dentistry, and Dr. Karen and myself, I mean, we really try and really stay on top of those changes, and really it makes our job easier. It's more comfortable for the patient. So really everything has changed since I started.
It's exciting, though. It
It's
really
very
is exciting
exciting.
where
Yeah.
it's going.
Yeah, some people might even say this is the golden age of dentistry. I mean, it's technology has really helped advance what we're able to do.
Amazing. Truly amazing. Dr. Karen, I understand that the practice has a website as well as a Facebook page, which is great. Tell us about some of the services that you offer through your website and Facebook that make it easier for patients to schedule appointments and things
Definitely.
like that.
So the website is www.smilewest.com. It's a comprehensive website. There's a huge part of it as educational, so you can, if you ever have any questions of what a root canal is, or what a crown is, what is the implants, you can watch the whole video. They're very nicely done, self-explanatory, so people can go there for education, which is really the foundation, I think, of medicine and dentistry. As far as the appointments making, you can definitely make your appointment through the website. If you have any questions, you can put a little comments, we'll call you back. If you have any questions, we'll call you back. We use reminding services as well, so if you're late for your appointment, you can let us know. You will get notifications about appointments as well, text message, email, whatever you'd like. You just hit yes or no, and you'll write on a schedule, so everything is integrated, everything is secure and HIPAA compliant. So basically, it's a lot of our patients, everybody has a smartphone now, so it's just so easy to do that now.
That's great. That's great. You've thought of it all. That's great. Wonderful. Dr. Nick, in closing, if you could give our audience advice, one piece of advice that you would like to leave with them as patients, what would you offer?
Well, I would say, I mean, don't wait. I mean, these are the things like, you know, we're big into prevention. You know, most things in life, the longer you wait, the worse it is. So,
This is true.
you know, it's you know, it never gets easier. So, honestly, if you're having an issue, you're better off getting it looked at, you know, really as quickly as you can. But some things can be very serious. I mean, some infections can be life-threatening. Bacteria gets into your bloodstream. So it's really not a good idea to let things fester. And so it's really important that you get looked at early. And unfortunately, a lot of things don't hurt. And when they do hurt, it's too late. So, you know, we hear that comment a lot that, you know, well, it doesn't hurt. Well, well, that's good, but we've caught it early enough, and so we can correct it very easily before it does hurt. So, unfortunately, pain is a great motivator, but a lot of times it's too late. So our advice is just, be early, just get it looked at as early as you can, and
Be proactive.
Be proactive, yes,
Just
thank you.
your favorite quote about a tree?
Yeah, the best, yeah, that's right, yeah.
What's that?
The best time to plant a tree was 20 years ago.
Okay, well, very good, very good. Well, we're thrilled that you came, and I learned so much, and I'm sure our viewers did as well. Thank you both, and we wish Cornerstone Dental Group much, much success in the new year and as you continue to establish yourself in Westford.
Thank you.
Thank you.
And Kathleen, I really want to thank you because you and the Middlesex West Chamber of Commerce have been very helpful to us, and just getting our name out there and welcoming us to the community. So I really want to thank you too.
Oh, you're most welcome. We're here to serve you, and thank you so much. That's very nice of you.
Thank you.